all about causes and treatment of hemorrhoids. ICD-10. What causes hemorrhoids? Whilst the symptoms and treatments are very well documented, the exact cause of hemorrhoids is still relatively unknown. Several factors come into consideration when determining the root cause of hemorrhoids, but in general, it is overweight, pregnant, and elderly people who are at a higher risk of developing them. Some of the most documented factors which are believed to play a role in the cause of hemorrhoids include extreme abdominal pressure, obesity, sitting or standing for a prolonged amount of time, intense coughing and sneezing, vomiting, straining while passing stool, and failure to exert breath during physical labor. Another factor which needs to be taken into consideration is your diet. Eating habits can come into play when looking at the cause of hemorrhoids, and proper knowledge can help with the prevention of them likewise. Diets which are high in processed foods, and low in natural fiber, are more likely to cause hemorrhoids, so eating plenty of fiber can go a long way in preventing the condition. Constipation, being the side effect of a low-fiber diet, can contribute to the development of hemorrhoids in two ways. Firstly, the excess straining when trying to pass stool can aggravate the hemorrhoids, and also, the stools produced will tend to be bigger and firmer, which can further irritate the swollen veins. Genetics can also play a part in the development of hemorrhoids, since the weak structure of veins in some people can be passed down through the genes. If hemorrhoids are common in your family, then chances are, you are more vulnerable to the condition, although there is little evidence to support this association. For women who are suffering from hemorrhoids during pregnancy, an explanation can be found in the fact that increased pressure from the fetus on the abdomen, as well as the changes in hormones, can apply additional pressure to the hemorrhoidal blood vessels, causing them to swell and enlarge. Symptoms can increase during the delivery of the baby, but surgical treatment is rarely needed, and the hemorrhoids will usually subside and retract back into the anus within a few days. To summarize the possible causes of hemorrhoids, the most commonly known ones are obesity, or being overweight in general, heavy lifting on a regular basis, sitting for extended periods of time, repeated coughing and/or vomiting. Age: elderly people have an increased risk due to the weakening of supporting tissues. Pregnancy. Family history of hemorrhoids. Lack of dietary fiber. Prolonged constipation or diarrhea. What are the different kinds of hemorrhoids? Diagnosing hemorrhoids is generally a straightforward procedure, but there are two different categories in which this disorder is classified into: internal and external. When self-diagnosing oneself with hemorrhoids, people will generally assume that any pain or discomfort around the anal rectal area is just hemorrhoids. However, both types of hemorrhoids come equipped with their own unique symptoms and treatments which must be recognized in order to treat them properly. Internal hemorrhoids are typically found inside the rectum, deep enough to be out of sight. Thanks to the lack of pain-sensing nerves in this part of the body, internal hemorrhoids are generally free from pain, and the only obvious symptom is the presence of blood when passing stool. The amount of anal bleeding can range from a few spots on the toilet paper, to an excessive amount dripping into the toilet bowl. On some occasions, internal hemorrhoids may prolapse, which simply means that they enlarge enough to protrude outside of the anal sphincter, making them visible and touchable. Prolapsed internal hemorrhoids are easy to spot, thanks to their distinctive pink coloring, which makes them stand out from the rest of the tissue around that area. While internal hemorrhoids are typically painless, if they happen to protrude, the increased pressure and the increased irritation from clothes and movement may cause some discomfort. Protruded hemorrhoids will generally recede back into the rectum on their own accord, but in the event that they don't, they can be encouraged by gently pushing them back into place. External hemorrhoids are inflamed veins which are typically a lot more painful than those which lie internally, and if symptoms fail to subside within a week or so, then surgical intervention may be a requirement. External hemorrhoids often lie within the anus, but prolapsing to the outside is common, and is usually caused by a passing stool. Thrombosis is an unfortunate condition in which blood clots form within the prolapsed external hemorrhoid, making them extremely swollen and painful. Thrombosed hemorrhoids can be identified by their often blue or purple coloring, which is usually a result of broken blood vessels and blood clots which form within them. The lifespan of external hemorrhoid can range from a couple of days to a couple of weeks, but the main symptoms generally dissipate within a week, depending on the treatment. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.